Good morning everyone. Welcome to Whiteboard Pharmacist Grade 2 coaching classes. Today we are going to discuss about the paper discussion of Grand Test 5 exam conducted. Okay, let us see each one by one question and its explanation. Okay, let us start with the first question. Which of the following is not a common emulsifying agent? So, is asking here the examples of emulsifying agents. If you see here, lecithin is a common emulsifying agent, okay, and gum arabic is the plant source for emulsifying agent. So, this is also emulsifying agent example. This is also emulsifying agent example. If egg yolk, you see this is the animal source. So, lecithin sources like soya bean, egg yolk. So, all these three options A, B, D are examples for common emulsifying agents. So, this is not the, so sodium chloride, instead of that if it is sodium lauryl sulphate, then it is considered as emulsifying agents. Since answer sodium chloride is given, so this is not a common emulsifying agent. So, answer is C. Next question. One second. Move over. Okay. Okay, next question. So, it is assertion reasoning. Emulsions can be destabilized by changing the pH of the temperature. Okay, this sentence is yes, correct. Emulsions can be destabilized by changing the pH or temperature. Why? Because see, emulsifying agents are used for the stabilization of the emulsion, okay, in order to make the emulsification. Okay, this emulsifying agent, when it is getting affected by the pH or temperature changes, then obviously its ability to stabilize the emulsion is getting affected. That is why if you see the reason, emulsifying agents are sensitive to changes in pH and temperature, which can alter their effectiveness. Since emulsifying agent is getting affected, emulsion stabilization will be affected. That is why both A and R are true, and R is the correct explanation of assertion. Next question. Which of the following is an example of a common emulsifier used in the food? Thus now we have discussed sodium chloride is not an emulsifying agent. Lecithin, so examples, sources like soybean and egg yolk. So, lecithin is an example for emulsifying agent, and calcium carbonate, magnesium sulphate are not emulsifying agents. So, answer is B. Next question. What is the primary reason for adulteration in herbal products? So, the aim of adulteration actually is when the demand is very less, when the demand is more and the supply is less. In order to balance this, okay. So, the another low quality product instead of the actual original product is being added. So, this is called adulteration, adding of the another constituent instead of that original constituent which looks alike, okay. So, another important reason for adulteration is getting profits, okay. For getting profit margins, generally adulteration is there. So, profit margins is one reason, and another reason is meeting the demands in a cheaper way. When the availability of that original herbal product is very less, okay, and also when it is very costly, then that original herbal product is adulterated by cheaper products, okay. So to enhance the therapeutic effect is not correct, to increase the profit margins is correct, to improve the taste is not correct, to ensure the safety is also not correct. So the option is here C. Next question, adulteration in pharmacognosy refers to the intentional substitution of original plant material with similar looking but inferior quality substances. So just now I have said, so it is a substitution of cheaper quality material instead of original pure material, okay. So many adulterants in herbal products are added to increase bulk or weight. So both the statements are perfectly true. So adulteration is nothing but adding cheaper constituent in order to increase its weight, okay. So both statements are true, and option is A. Next question, what is a common adulterant found in powdered turmeric that is used to enhance its color? So we already discussed. So common see, adulterants look alike the original product, okay. So here if you see, what is a common adulterant found in powdered turmeric, okay, lead chromate, not papaya seeds, starch not at all, and sand. Lead chromate is added as an adulterant for the turmeric. So answer is B. Next question, the color produced in limit test for arsenic is, okay, limit test for arsenic, okay. If you see here, we will use this 𝐷𝐷𝐷 apparatus to test the amount of limit of this arsenic. So arsine gas, when it is exposed to mercury chloride paper, okay, it forms this complex yellow color stain with this mercury. So this is yellow color stain. So yellow stain, the intensity of yellow stain represents the amount of arsenic present as impurity in the sample. So this arsine gas, when it is exposed to this, see, this is the mercury chloride paper, okay, this is mercury chloride paper. So the arsine gas from the sample, when it is placed, when it is touching this mercury chloride paper, yellow color stain will be formed, okay. This yellow color stain intensity will show you the how much amount of this arsenic is present in the sample. So answer is B. Next question, variola virus causes the disease. Whooping cough is bacterial infection caused by Bordetella pertussis. So this is not correct. Rubella is a viral infection. It is a RNA virus. So ruby species, okay. So it is also not correct. Yellow fever carrier is mosquito here. This is also not correct. Smallpox is a viral infection caused by variola virus. So answer is D. Next question, blood clotting factor 11, okay. Here proaxilrin is clotting factor 5, Heisman factor is clotting factor 12, okay. Proconvertin is clotting factor 7. So the answer is plasma thromboplastin antecedent C. So you have to, there are clotting factors list is there, you have to remember the name of the factor number and the name, okay, so that you can answer this type of questions easily. So you just take the list of that clotting factors, blood clotting factors, various blood clotting factors and their name. Okay, so that list will be the 12 clotting factors. You have to study it. So here the answer is C. Next question. Scapula and clavicle is a part of. So if you see, if you take this axial skeleton includes this part, thoracic and this skull part. Okay. So this is not one correct one. Pelvic girdle is this one which connects the lower limbs to the upper part. Okay. So pelvic girdle is also not one. Hyoid bone is the shoulder part, here this one. So scapula and clavicle is the appendicular skeleton. Scapula and clavicle comes in the appendicular skeleton. So the answer here is D. Next question. Methanamine is a uses of methanamine very important. It is used as urinary tract antiseptic. Okay, it is having the structure like this. It is having a cage like structure. Okay. Cage like structure is seen for methanamine. So methanamine is used as urinary tract antiseptic. This is also called as hexanamine. Another name for methanamine is hexanamine. Hexanamine or methanamine both are same, used as urinary tract antiseptic. So answer is A. Next question. Pectin is standardized based on not mucilage content or flocculent property. Pectin is having the tendency to form this gel like nature, that is why its jelly grade is measured as a standardized base for pectin. Okay. So it forms gel like nature. Okay. So it is not colloidal property. The answer is C. Next question. Sulphonamides should be avoided in patients with following conditions. So here answer is glucose 6-phosphate dehydrogenase, G6PD enzyme deficiency. G6PD deficiency in a person causes anemia. If you see the mechanism of action of sulfonamides, it acts on folic acid synthesis. That means what? It inhibits the folic acid synthesis. So here the RBC will be affected. Okay. So if a person who is taking the sulfonamides, their RBC is compromised, and moreover on top of it, if the person is having this G6PD deficiency, he is having already anemia problem. So this problem will be elevated, okay, increased if G6PD deficient person is taking drugs like sulfonamides, so which are having action in the whatever the drugs that are having mechanism of action on the folic acid synthesis. Those drugs should be avoided in the patients who are taking who are having this glucose 6-phosphate deficiency, dehydrogenase deficiency. Okay. So sulfonamides, dapsone, chloroquine, nitrofuran. So these kind of drugs combination should not be given or contraindicated in patients having glucose 6-phosphate dehydrogenase enzyme deficiency. Why? Because the anemia condition will be alleviated. Okay, sorry, increased. That's why it has these following drugs should be avoided in the patients who are having this glucose 6-phosphate dehydrogenase enzyme deficiency. So the correct answer is B. This concept is very important from exam point of view. Next question. What type of bacteria are most commonly targeted by sulfonamides? Sulfonamides are having broad spectrum activity. That's why not completely, not only gram positive or gram negative, both gram positive and gram negative bacteria are targeted by sulfonamide. So, correct answer is C. Next question. Which of the following is a long acting sulfonamide? Okay. So, sulfonamides classification you have to go through: long acting, short acting, intermediate acting. If you see here, sulfadoxine is a long acting sulfonamide. Sulfadoxine is an example for long acting sulfonamide. Sulfamethoxazole is an example for intermediate acting sulfonamide. Intermediate acting sulfonamide. And sulfadiazine is an example for short acting sulfonamide. Which of the following is a topical sulfonamide? Sulfacetamide is an example for topical sulfonamide. Okay. So, sulfadoxine is long acting, sulfamethoxazole is intermediate acting, sulfadiazine is short acting, sulfacetamide is an example for topical sulfonamide. So, the correct answer here is A. Next question. Nimbolites are chemical constituents used as. What are nimbolites? Nimbolites are the chemical constituents seen in neem, Azadirachta indica. Azadirachta indica. Okay. So, nimbolites are the common chemical constituents that are present in neem plant, and these are having different activities like antioxidant property, antimicrobial property, anti-inflammatory property, anti-inflammatory, anti-cancer. Okay, different uses are there. Okay. For this nimbolites. So, nimbolites are seen in neem, and this is not arithmetic or analgesic or antihistamine, it is exactly having antimicrobial properties. So, answer is C. Next question. The trituration method is used only in those cases where the base is liquid or semi-solid. The fusion method is used when the base is semi-solid or solid in nature. If you see, there are two concepts here: trituration method and fusion method. What is trituration method? When the constituents, ingredients, medicaments are triturated, homogenized or made into small particles, okay, it is mixed with adding small amount of diluent or base. Okay. When the base is liquid or semi-solid, you will go for trituration method. How you will do trituration? By adding the medicaments and by making it to a homogenized mixture by reducing its particle size. Okay, trituration is done to dilute when the drug is very, very potent, or to make the particle size very, very less. Okay, you will make into a homogenized mixture, even mixture, by adding small amounts of base. Okay, liquid base or semi-solid base, that is called trituration method. Fusion method is what? When the base is solid. First you will go for melting. Okay, so the ingredients will be melted first and then is made into a homogenized mixture. So that is called fusion mixture. So here medicaments or ingredients are melted first. Here made into small particles, medicament or ingredients are made into small particles, but their size is reduced and diluted slowly by adding base. That is the difference between trituration method and fusion method. Therefore, here both the statements are true. Answer is A. Next question. Which of the following is the chemical test for saponin glycosides? have to make a list of all the different types of names of the tests and the respective representative or corresponding test name and to which alkaloid or glycoside or to which element the test is being done. So, here saponins, okay. Saponins glycosides are tested by foam test. Then Sulphonamides test, it is for testing cholesterol, okay. Sulphonamides test is done for cholesterol. 𝐓𝐞𝐬𝐭 test, cardiac glycosides. 𝐓𝐞𝐬𝐭 test is for cardiac glycosides, okay. And ammonia test is for flavonoids. Ammonia test is for flavonoids. Therefore, here for saponins we will do foam test. Answer is A. Sulphonamides test is cholesterol, 𝐓𝐞𝐬𝐭 test is cardiac glycosides, ammonia test is for flavonoids. Next question. Match the following vitamins with their respective functions. Name of vitamin A is retinol. Retinol is used for vision. So, one is B. Check one is B. Okay, we will see. Next, vitamin B12, cyanocobalamin. Cyanocobalamin. Vitamin B12 is cyanocobalamin. Vitamin A is retinol. Vitamin B12 is useful for the red blood cell formation. Okay, vitamin B12 is an important component for RBC formation, blood formation. Vitamin C is ascorbic acid. Ascorbic acid, and vitamin C is useful for collagen synthesis. 3C, 2D, this is the option. 4A, vitamin D, calciferol. Calciferol is used for bone health. So, vitamin D function is bone health maintenance. Vitamin C is collagen synthesis, ascorbic acid. Vitamin B12 is cyanocobalamin, red blood cell formation. Vitamin A is retinol, used in the vision and immune functioning. So, here option is, correct answer is B. Next question. Which vitamin deficiency is known to cause scurvy? So, here also each and every vitamin, their names, their deficiencies and functions. Try to make it as a table. Okay, vitamin A deficiency causes xerophthalmia. Vitamin C is scurvy. Deficiency of vitamin C causes scurvy. Vitamin D deficiency causes osteomalacia. Vitamin D deficiency is osteomalacia. Vitamin K deficiency causes hemorrhage. The function of vitamin K is coagulation. If it's vitamin K is responsible for coagulation, if it is not there, it causes bleeding. That's why hemorrhage. Vitamin D is responsible for the bone strength and bone formation. So, bone related deficiency will be, bone related problems will come, that is called as osteomalacia with vitamin D. Vitamin C is scurvy, vitamin A is xerophthalmia. Okay. Vision related problems with vitamin A deficiency. Next question. So, here answer is B, scurvy. Assertion reasoning type, vitamin K deficiency can lead to excessive bleeding. Yes. Vitamin K is responsible for the synthesis of coagulant factors. Coagulant factors helps in the coagulation of the blood. So, if it is not there, then obviously it causes bleeding. Reason, it is necessary for the synthesis of clotting factors. So, it is exactly matching. A is correct and R is the correct explanation for A. Okay, vitamin K is responsible for the synthesis of coagulation factors. So, answer is here A. Next question. Which parenteral route is commonly used for vaccines? Okay, here intravenous route is giving injection through the veins. Okay, IV mode of giving route of administration is for IV fluids like electrolytes. Okay, electrolytes are given, IV fluids are given in intravenously. Intradermally is giving injection through the dermis layers. Okay. Intramuscular is used for giving vaccines. Subcutaneous is for skin layers. Okay. Subcutaneous like insulin are given, where oral way of oral absorption is not fine, then the drugs are given subcutaneously. Example is insulin. Okay, here intramuscular vaccines are given through intramuscular mode of route. Okay, so here answer is C. Next question. Which type of parenteral administration involves injecting the medication into fatty tissues under the skin? So just now we have seen, intravenous is through the vein, injecting into the veins. Okay, intramuscular is through the muscles. Subcutaneous is the fatty layers or the skin, medication into the fatty tissue under the skin. Okay, under the skin, the fatty tissue, into that it is injected. Intradermal is in between the skin layers. Okay, so here the exact answer is subcutaneous, which is given into the fatty tissues that are present under the skin. Subcutaneous. Intradermal is in between the skin layers. That is intradermal, intravenous and intramuscular. So vaccines are given through intramuscular, insulin is given to subcutaneous, okay, and IV fluids are through intravenous. Ascorbic acid, vitamins, some vitamins are given through this intradermal. So here answer is C. Next question. Which of the following is a short acting penicillin? So if you see here, nafcillin, piperacillin, okay, nafcillin and piperacillin, these are semi-synthetic penicillins. Penicillin G and penicillin V, natural penicillins, are short acting penicillins. Okay, so here answer is C. Next question. Recently, which institute developed the investor information and analytics platform? Investor information and analytics platform. IIT Madras have developed this one, investor information analytical platform for, it is a platform for startups, okay, entrepreneurs, okay, and young public also. It is a platform for this interaction between the startup entrepreneurs and the government schemes, bankers, okay, investors, venture capitalists. So it is a platform which have a meeting between these two, okay. Ideas is for the startups and the investments and investment bankers, okay. This is the partnership or the interaction between these two is done with this investor information and analytical platform developed by IIT Madras. So here answer is A. Next question. Lepidolin binds tightly to both catalytic site and exosite of the following. Here lepidolin is an example for direct thrombin inhibitor. Okay, lepidolin is an example for DTI, direct thrombin inhibitor. So it goes and binds to the thrombin and inhibits the thrombin, okay. So catalytic site and exosite 1 of the thrombin, lepidolin will go and bind and it shows the antiplatelet action. That is why here the answer is thrombin A. Next question. Transmitting agent of rabies. Rabies is caused transmitted by the saliva of infected cats, dogs, infected bats, dogs and rats, saliva, and the effect of rabies is brain inflammation. One important point is, person who are affected with the rabies or infected with this rabies have this fear of water. They have the fear of water. So here option is D, dog. So rabies is caused or spread through the saliva of dogs, bats and rats. Next question. Linoleic acid is an example for essential fatty acid. Linoleic acid is obtained from linseed and it has C18, that means 18 number of carbons in its structure, and it have 2 double bonds. 2 double bonds, one double bond is at 9th position and another double bond is at 12th position. So, and the conformation is 2 double bonds exist in cis form. So linoleic acid is obtained from linseed, which is having 18 number of carbons, and this is an example for polyunsaturated fatty acid. It is PUFA, polyunsaturated fatty acid, and it is an essential fatty acid. It is an example for essential fatty acid. It is having 18 number of carbons with 2 double bonds. First double bond is at the 9th position, second double bond is at the 12th position, and the conformation is cis conformation. So here the answer is A. Next question. Deficiency of iron leads to, deficiency of iron, everyone knows, deficiency of iron leads to anemia. Addison disease affect the adrenal gland. If it is affected, then it leads to Addison's disease. Wilson's disease, lack of ceruloplasmin. Lack of ceruloplasmin. Ceruloplasmin is a one which carries the copper ions, copper carrier. If it is not there, you will get the deficiency of copper. That is called Wilson's disease. Rickets is bone disorder, rickettsia. So here iron deficiency is anemia, lack of blood. So here answer is C. Let's move to the next question. Paneth cells secrete. Paneth cells are, these are the cells which are present on the lining, epithelial lining of small intestine. Whenever it senses that some antigens or bacterial or any antigens enter, as a response of immune response, whenever it senses the bacterial or any antigen it is entering, as an infection, it releases some immune related cells, like tumor necrosis factor alpha, lysozyme, as an immediate immune response. So these cells secrete certain components as a result of the entry of, when it is senses any bacterial infection or antigens entering as an immune response, these cells secrete lysozymes, okay, lysozymes, okay, as an immune response, and these are present on the lining, epithelial lining of the small intestine, okay. So that is a function of Paneth cells. So answer here is C, lysozyme. Next question, assertion reason type. Oral rehydration therapy is effective in treating cholera. Exactly. ORS is given for cholera treatment. Why? Because cholera causes diarrhea, vomitings, loss of lots of fluids. So in order to compensate the loss of electrolytes, loss of fluids from the body, ORS is given, okay. So here assertion is oral rehydration therapy is effective in treating cholera. Yes, cholera causes dehydration due to severe diarrhea and replenishing fluids, and electrolytes is replenishing fluids and electrolytes is crucial. Yes, that is why ORS is given. So answer A is option is A. Assertion and reason are true, and reason is a correct explanation for assertion. Next question. Which hepatitis virus has a vaccine available for prevention? Remember, there is no vaccine for hepatitis C. Hepatitis A and B both are having the vaccine for prevention. Okay, so hepatitis virus vaccine available for prevention, answer is D, both A and B. Next question. Cholera is caused by the 𝐓𝐵RIO cholerae bacterium, and it primarily spreads through the contaminated food and water. Okay, cholera, 𝐓𝐵RIO cholerae, already we came across. So first statement is true. Next statement is what? It spreads through the contaminated food and water. That's why cholera occurs. Okay, contaminated with food and water contamination leads to viral infection, cholera. Okay, bacterial infection, 𝐓𝐵RIO cholerae. Okay, so both the statements are true. Answer is A. Next one. Under which condition can a pregnancy be terminated after 20 weeks? As per the amended provisions of the Medical Termination Pregnancy Act. Okay, so provisions or amendments are done in 2021 to the Medical Termination Pregnancy Act. So according to that, after the amendments, with the opinion of one registered medical practitioner, up to 12 weeks is the older one. Okay, so this is not the with up to 22 RMPs are required, 20 weeks. Okay, only with the approval of judicial body is not the option. Only if there is a substantial risk to the mother or fetus. So according to the amendments, if there is a termination of pregnancy, it requires 2 RMPs opinion for 20 weeks, 20 to 24 weeks. But if there is a fetal abnormalities, there is no, okay, if there are fetal abnormalities, there is no time limit for this gestation period. Okay, so its gestation period limit is not there. So only if there is a substantial risk to the mother or fetus, then termination can be done. Okay, so which conditions a pregnancy can be terminated after 20 weeks? When there are fetal abnormalities and risk to the mother and the fetus. So this is not the option. Answer is C. Next one, gelatin is obtained by the partial hydrolysis of, it's not starch or gum, it is collagen. Okay, option is B. Gelatin is obtained by the partial hydrolysis of collagen. Next point, next question. Who can provide consent for the termination of pregnancy under the Medical Termination of Pregnancy Act 1971? for a minor or a mentally ill person. Okay. So, what this MTP Act 1971 is telling about a minor or a mentally ill person pregnancy. Okay. So, the pregnant woman herself cannot decide, the registered medical practitioner cannot decide, there should be a guardian for the pregnant woman. Okay. Here who can provide consent? Only the guardian should provide the consent for the termination of the pregnancy under the MTAP Act. Okay. So, here the guardian of the pregnant woman, it is not the state government. So, guardian should be there. Guardian is one who is taking care of that minor or mentally ill person. Next question. Which of the following is an example of an enzyme? So, one point to be remembered is whatever the ase is there at the end, ase, okay, whatever the name it is, then it is considered as, then it is an enzyme. So, glucose, it is a polysaccharide, sugar, DNA is a nucleic acid, amylase, ase is there, so it is an enzyme, and ATP, it is a chemical molecule which is having nucleic acid, adenine plus sugar, ribose plus phosphate group. Okay. So, here it is not an enzyme, this is an enzyme. So, answer is C. So, ATP is adenine triphosphate, it consists of adenine nucleic acid base, adenine base and sugar and phosphate group. So, answer is here C. Next question. Coenzymes like NAD plus and FAD are derived from vitamins and are crucial for enzyme activity. Okay. Here two statements are, coenzymes like NAD plus and FAD are derived from vitamins, yes. Okay, these are derived from vitamins. NAD is obtained from niacin, B vitamin, and FAD is from riboflavin. Okay. These are coenzymes, these are called coenzymes. Coenzymes means what? Enzymes which the components which are helpful for the enzyme activity, which helps the activity of the enzyme are called coenzymes. These coenzymes are derived from vitamins. So, you should require the vitamins like niacin and riboflavin for the development of coenzymes like NAD and FAD, okay, nicotinamide adenine dinucleotide and flavonine adenine dinucleotide, and these are responsible for the enzyme activity. So, both the statements are true here. Okay. So, this help the activity of the enzyme, enzymatic activity. Okay. That is why both the statements are true. Answer is A. Next question. Coenzymes are permanently bound to their respective enzymes. It is not exactly true. So, all the coenzymes are not permanently bound to the enzymes. Some are temporarily bound and some are permanently bound. Okay, reason, coenzymes are organic molecules that assist enzymes during the catalysis of reactions. So, next statement is correct only here. So, these are the organic molecules that they will assist the enzymatic function, okay, during the catalysis reactions, but not binding permanently to the respective enzymes. Some are temporarily bound and some are permanently bound. That is why A is false and R is true. Okay, answer is D. Next question. Penicillin V is dispensed as an dry powder and granule form. Okay, penicillin V is dispensed as a dry powder and granule form. Penicillin V is stable in aqueous solution. See, penicillin V is it's not stable in aqueous solution. Okay, it is unstable in aqueous solution. Since it is unstable in aqueous solution, it is given in the form of a, is dispensed in the form of a dry powder or granule form. So, if it is not stable, then it is A is correct and B is the correct reason. Okay, assertion is correct and reasoning is this one. Okay, penicillin V is not stable in aqueous solution, that's why it is dispensed in dry powder form or granular form. But here it is stable in aqueous solution, since it is given like that, assertion is false and reason is true. Answer is D. Next question. Cotrimoxazole is a combination of sulfamethoxazole and trimethoprim, where exactly, and it is used in the treatment of pneumocystis in patients with AIDS. Yes, both the statements are true. Cotrimoxazole is a combination drug. It is a combination of trimethoprim and sulfamethoxazole, and it is used for the treatment of pneumocystis in patients with AIDS. Okay, AIDS patients who are having this, have this pneumocystis, then it is used, cotrimoxazole is used. So both statements are true here. Answer is A. Next question. Which of the following is a common preventive measure against respiratory infections? Common respiratory infections, let us see the options here. Eating raw vegetables, it's a healthy way. Next one, wearing mask in crowded places, yes. Excessive use of antibiotics, no. Avoiding physical exercise, no. Eating, no. Rather than this, wearing the mask in the crowded places is the preventive measure against respiratory infections, because it causes through the breath. Okay. So answer is B. Let us see the next question, assertion reasoning type. Consuming food that has been properly cooked can prevent most forms of food poisoning. Yes. Okay. Food poisoning is due to the improper storing of the food, not refrigerating some food items which are which require refrigeration. When it is not being done, then it leads to food poisoning. When certain foods which are not cooked properly at the particular temperatures, that also leads to food poisoning. Some meat, some food items like meat have to be cooked properly at temperatures, exact temperatures, and so that also leads to food poisoning. And cleaning and washing, okay, not maintaining proper hygienic conditions also leads to food poisoning. Now let us see what the reason it is discussed here. Cooking food at high temperatures kills most bacteria, viruses and toxins that causes foodborne illness. That's why consuming food that has been properly cooked prevents this food poisoning. So A is correct and it is an R is correct explanation for assertion. So food poisoning, one of the reason is not cooking properly. So if we cook properly, then it can be avoided. Next question. Food poisoning can only be caused by bacteria and not by viruses or toxins. No, food poisoning can be due to any of the viral improper maintenance. So the food can be infected with bacteria, any toxins. So food poisoning is a result of bacterial, viral infections and toxins also. So first statement is not correct. E. coli is one of the common bacteria, yes, that is responsible for food poisoning. Food is mostly infected with the common bacteria E. coli that is responsible for causing various food poisoning, that leads to person who is consuming this poison food is having the infections like diarrhea and cholera. So E. coli is one of the common bacteria. So answer is A is true, A is false. A is false and second statement is true. Answer is D. Next one, which bacterium is commonly associated with food poisoning due to undercooked poultry? Undercooked poultry, chicken, eggs. Okay. So when it is not cooked properly, then it is undercooked. So undercooked poultry is infected with the common bacteria Escherichia coli, Salmonella, Bacillus anthracis. So A, B and D is the correct option, not Vibrio cholerae, already contaminated food water, okay, not poultry. So A, B and D are common bacteria that are seen in uncooked poultry. Next one. Following drug increases the risk of rhabdomyolysis when combined with lipid lowering drug. Just see what are the lipid lowering drugs in these options. So if you see ketoconazole, it is a antifungal drug. It is not lipid lowering drug. It is antifungal drug. Aspirin, it's an NSAID. Ropinirole is used for treatment of Parkinson's. 𝐵-5-0, all fibrates are lipid lowering drugs, reduces the levels of serum triglycerides. Okay. So, fibrates, example 𝐵-5-0. 𝐵-5-0 is a lipid lowering drug. Okay. It causes the rhabdomyolysis, that is affecting the muscle. Muscle tissue breaks and releases its components into the blood. That is called rhabdomyolysis, that is caused due to 𝐵-5-0. So, answer is A. Next question. Acid-fast staining is used to identify. Actually, acid-fast staining is a technique which is used to identify the organisms which are not stained by the or which are not decolorized by the acids. Okay. So, a specific bacterium that is responsible for causing TB, leprosy. Okay. So, causative agents of TB and leprosy are Mycobacterium and another species Nocardium. Okay. Mycobacterium and Nocardia, these two are done by stained by acid-fast staining method. Okay. This is done when normal staining procedures are not applicable. Because they have a thick fatty layer, and that is why normal staining and acids cannot stain this Mycobacterium because of the presence of this lipid layer on the cell wall. That is why these are stained by using acid-fast staining method. In this we will use one dye called carbofuscin. Okay. With this staining is being done. Okay. So, this here the answer is Mycobacterium, which is responsible for causing TB. Answer is B. Next one, biological source of red squill. Biological source of red squill is Argenia maritima. Argenia maritima, Phytolacca dodecandra, Cymbopogon. Cymbopogon is this is also not correct one. Calotropis, Cymbopogon. Okay. Argenia maritima is the squill. Okay. Argenia indica is Indian squill. Maritima is red squill, European squill. So, answer is A. Next question. Sulfamethoxazole plus trimethoprim is a combination of cotrimoxazole, not clotrimazole. Okay, you will know that answer, but you will get confused. Not clotrimazole, cotrimoxazole, not cotrimethoxazole. Okay, cotrimoxazole, cotrimethoxazole. Okay, next question. Which of the following bacteria is most commonly associated with the development of peptic ulcers? Peptic ulcers is caused by acidity, acid conditions, and one bacterial infection, that is Helicobacter pylori. Okay? Helicobacter pylori infection causes peptic ulcers, and the treatment is using antibiotics and proton pump inhibitors, antibiotics like amoxicillin and proton pump inhibitors like omeprazole. Therefore, the answer here is C. Helicobacter pylori is responsible for causing peptic ulcers. Next question. Peptic ulcers are solely caused by stress and spicy foods? No. Not solely, because they are also caused due to bacterial infections. They have no relation to bacterial infections? No. Peptic ulcers are, just now we discussed, peptic ulcers are caused due to spicy foods and stress conditions, and also due to bacterial infections like Helicobacter pylori infection. That is why here peptic ulcers solely caused by stress and spicy foods is not wrong. Solely means exclusively. Okay, it is wrong. They have no relation to bacterial infection is also wrong. So, here answer is B. Both statements are false. Next question. In type 2 diabetes, the primary pathophysiological issue is autoimmune destruction of beta cells. Primary pathophysiological issue, it is insulin resistance. Insufficient dietary intake of glucose, no. Overproduction of insulin, no. Destruction of beta cells, it is a primary insulin resistance is a first in type 2 diabetes. Okay, first issue. After that only rest of the things comes. So answer is here B. Medicinal and Toilet Preparations Excise Duty Act 1955 applies to which of the following products? So MTP, Medicinal and Toilet Preparations Act 1955, intention is to collect the excise duty from the preparations, from Ayurvedic preparations and allopathic preparations which are using alcohol as an ingredient, okay, and also some narcotics as their ingredients. If that ingredients either in the Ayurvedic preparations or allopathic preparations, if the ingredients are containing the alcohol or any narcotic substance, then the excise duty will be levied on that particular preparations, okay, on that particular formulations. So that is called Medicinal and Toilet Preparations Act 1955. Now let us see the options. So it's not on it's not collecting excise duty on foods containing alcohol. It is excise duty collection on medicinal preparations. So allopathic and Ayurvedic medicinal preparations containing alcohol or narcotic drugs. If that is there, then they can collect the excise duty. Only cosmetics, dietary supplements, no. Answer is B. Next question. The following are seen in the structure of wintergreen oil. What is wintergreen oil? Wintergreen oil is methyl salicylate, which is having very good smell, okay, that is relaxing and reduces pain, okay. Its name is methyl salicylate. So the structure is OCOCH3 and OH group. Alcohol group is there, ester group is there. Not ester acid, not alcohol acid, not amine, ester and alcohol. So wintergreen oil consists of ester and alcohol. Option is A. Next question. Which of the following is a key feature of the Medicinal and Toilet Preparations Act 1955? That is what we discussed. Regulation of pricing of medicines is done by National Pharmaceutical Pricing Authority, not this MTP. MTP is only to collect the excise duty on alcohol preparations and narcotic preparations. So it is not pricing. Pricing is done by National Pharmaceutical Pricing Authority. Imposition of excise duty on preparations by preparations containing alcohols, narcotics and psychotropics, it is the MTP Act 1955. Control and sale of the over-counter drugs, licensing, this is Drugs and Cosmetics Act. Drugs and Cosmetics Act, drug control of the sale of the OTC drugs. Licensing of pharmacies and retail drug stores is by CDSCO. So here MTP Act 1955 is this one. Answer is B. Next question. Which substance is commonly tested in urine to assess kidney function? So one thing to assess the kidney function, creatinine levels are measured. High creatinine levels implicates the renal dysfunction. Bilirubin levels to see the liver condition. Creatinine is to check the kidney condition. Okay, bilirubin is for liver, creatinine is for kidneys. So here kidney function, answer is C. Next question. Anemia is commonly diagnosed through CBC test. Yes. Reason is a CBC measures the level of red blood cells, hemoglobin and hematocrit, which are indicators of anemia. Yes. So, CBC test is to identify anemia is commonly identified through CBC test. CBC test will give you the information about the levels of RBC, hemoglobin content, hematocrit. So, these are all the indicators of anemia, that is why. So, A is correct and it is the correct explanation for A. Okay, answer is A. Next question. Which condition is indicated by the presence of protein in the urea? Name itself indicates the answer is proteinuria. Higher amounts of protein, presence of protein in the urea, then it is proteinuria. Okay, sugars in the urea, glycosuria. Blood in the urea, hematuria. Pus cells or WBC in the urine. Okay, proteins, sugars in the urine, blood in the urine, WBC or pus cells in the urine, that is pyuria. Okay, here option is A. Next question. Beeswax is used as a stiffening agent in the ointments. Yes, beeswax is used as a stiffening agent in the ointments. Beeswax is a high melting point and making it ideal for giving consistency to topical preparations, and because of the stiffness and high melting point, it is used in the preparation of ointment. So, A is true and it is a correct explanation for A. Answer is A. Next question. What is the primary use of tragacanth in the pharmaceutical formulations? Tragacanth, it is used not as a flavoring, sweetener, coloring, no, it is a thickening and suspending agent. Obvious answer. Answer is B. Next question. Which type of beeswax is more commonly used in the pharmaceutical preparations? It is white beeswax. This white beeswax is the decolorized version of this yellow beeswax. Okay, not brown, red, it is white beeswax. It is a common commonly used in the pharmaceutical preparations, white beeswax. So, answer is B. Next question, assertion reasoning type again. Testosterone is only produced in males? No, it is produced in females also. So, testosterone is a hormone responsible for male secondary sexual characters. Yes, testosterone is responsible for male secondary sexual characters development, but it is also produced in some considerable amounts in female also. That is why A is false and R is true. Answer is D. Next one, which gland is responsible for the production of estrogen? So, if you see, thyroid gland, we all know this thyroid hormones T3, T4, okay, calcitonin, it is thyroid gland. Pancreas, insulin, and adrenal gland, it initiates it directs the development of some steroids for steroidal formations, but the production is done by ovaries. So, here estrogen is responsible for the production of, ovaries are responsible for the production of estrogen. Answer is D. Next question. A person who is an international migrant entering the country from place outside the country, that person which is not a part of our country but entering from as a migrant to the country, then he is called as immigrant. Next question. Radioisotope of cobalamin is used for the diagnosis of pernicious anemia is a disease which is B12 deficiency, caused due to B12 deficiency, that is cyanocobalamin. B12 is cyanocobalamin and the central atom is cobalt only. So, radioactive cobalt is used for the identification of this pernicious anemia. Option A is the correct answer. Next one, dash is identified in urine of a patient suffering from jaundice. Okay, jaundice, bilirubin will give you the liver condition. Okay, so bilirubin content in the liver is jaundice. For jaundice, you will identify the bilirubin content in the patient's urine. Okay, so answer is B. Next question, soluble form of iron. Ferrous form is a soluble form of iron. Okay, ferrous form is soluble form of iron. Ferric is insoluble form. Ferric is insoluble form. Hemosiderin is also in the ferric form. It is also insoluble. It is insoluble. Ferritin is insoluble. Ferrous form is the soluble form. So D is the answer. Ferrous sulfate is the answer. Remember. Next, propranolol is a propranolol. All lols are beta receptor blockers. Alpha receptor blockers are prazosin, doxazosin. Okay. So here answer is not alpha receptor blocker, it is beta receptor blocker. Okay. Cholinergic blockers no, mu receptor blockers also no. So propranolol is an example for C, beta receptor blocker. Answer is here C. Next question, according to ICH, impurities are classified as, so impurities are organic impurities are there, inorganic impurities, residuals in solvents, all. Answer is all. So according to ICH, impurities are organic impurities, inorganic impurities, residual solvents, okay, reagents, ligands, different types of impurities are there. So answer is here D. Next question, what is the primary purpose of the heat fixing bacterial smear before staining? Name itself is indicating heat fixing. That means the bacteria should not move while you are applying the stain. It should not be flooded and it should not move. That is why you will stick or fix this bacteria to the slide. So what is the purpose is to stick. So to kill the bacteria, no, if you kill the bacteria you cannot stain it or you cannot do the experiment. To make the bacterial cells adhere to the slide, yes, exactly. In order to remove that flushing of that bacteria when you are adding this stain or any other reagent. That is why you have to fix the bacteria to the slide first. To make the cells more permeable to the stains, no, to all of the above is no, answer is B. To make the bacterial cells adhere or fix to the slide, you will do heat fixing. Next question. In the streak plate method, a microbial sample is diluted across the surface of an agar plate to obtain isolated colonies. Yes, to obtain isolated colonies. And this method is ideal for quantifying bacterial populations. Actually, streak plate method, what you will do in the streak plate method is, it is just diluting the bacterial concentration so that the bacteria will spread all over the agar plate. Generally, we will be doing this in a quadrant way. Okay. So bacteria will spread all over the plate and it will develop colonies. So each colony you can identify. So that is the major usage of the streak plate method. Okay, it is diluted across the surface of an agar plate to obtain isolated colonies. But this is not the actual quantifying for this. In order to quantify, we will not use streak plate method. In order to make the colonies, we will use the streak plate method. For quantifying, there are other methods like turbidimetric method you will do. Okay, and also colony counting we will do. But it is colonies cannot be quantified using the streak plate method. That is why first statement is true, second statement is false. C is the answer. We will see the next question. Which staining technique is used specifically to identify Mycobacterium species such as the causative agent of tuberculosis? We already discussed. Some bacterium which are having the fatty layers, They cannot be stained by normal staining procedures. They cannot be decolorized by acids. That's why what are the bacteria examples of what are the organisms? Mycobacterium, which is causing TB. Mycobacterium, TB and leprosy containing leprosy diseases, and nocardium. These two can be stained by using only not gram staining, capsule staining, acid fast staining, flagella staining. Answer is C. Next question. Atropine poisoning is commonly treated with physostigmine. Yes, the antidote for atropine poisoning is physostigmine. Remember, paracetamol poisoning primarily causes hepatotoxicity. This is also true. The side effect of paracetamol is dose dependent overdosing of paracetamol, dose dependent hepatotoxicity. So, both statements are true here. Atropine antidote is physostigmine and paracetamol side effect is hepatotoxicity. So, both are true. Answer is A. Next question. Larger intake of antacids causes phosphate depletion. Okay, remember this one. Larger intake of antacids leads to depletion of the phosphates. Next question. Assertion reasoning type. Atropine overdose can lead to the life-threatening tachycardia and hyperthermia. Yes, atropine poisoning, the effects of atropine poisoning is tachycardia. Okay, then reason is atropine is an anticholinergic agent that inhibits the parasympathetic nervous system. Okay, anticholinergic agent, antimuscarinic agent, atropine. That's why the effects of it shows effect on parasympathetic sympathetic nervous system. That leads to conditions like tachycardia and hyperthermia. That's why A is the correct explanation for R. Answer is A. Next question. A woman has been using an oral contraceptive pill for several months and notices a reduction in acne. Which component of the pill is most likely contributing to this effect? Okay. Acne is due to the, it's like a pimple condition seen on the face, and that is due to testosterone. When oral contraceptive pills are used, it is a mostly estrogen will be there, and estrogen is responsible for reducing the levels of testosterone. When testosterone levels are reduced, then acne will be prevented or acne will be controlled. So, here acne is getting controlled when oral contraceptive pill is used. That is because of the presence of estrogen in that pill, which is responsible for reducing the testosterone levels in the person. That is why acne is also getting reduced. So, the answer here is B. Next question. Combination oral contraceptives are effective in preventing pregnancy and regulating menstrual cycles. Okay. So, combination oral pills, oral contraceptive pills. Combination oral contraceptive pills means combination of two hormones, mostly estrogen and progesterone. Okay, mifepristone. Okay, it is a combination of estrogen and progesterone. They both work together to prevent this ovulation stage and stabilize the hormone levels. That's why it is used for controlling the menstrual cycles also, and these are effective in preventing this pregnancy. Okay, so this is A is correct here, R is the perfect explanation for A. Next question. What is the primary active component in garlic? So, chemical constituent of garlic is allicin. Okay, curcumin is not, curcumin is turmeric, so it is not at all correct. Eugenol is from clove. Quercetin is a flavonoid present in so many compounds. Okay, allicin is present in garlic. Okay, allicin is responsible for medicinal properties like antibacterial property, antioxidant properties in the garlic. So, answer is B. Next question. 𝐓𝐞𝐬𝐭 is commonly known for its effects on which organ in the human body? 𝐓𝐞𝐬𝐭 common name is 𝐓𝐞𝐬. It is also called as 𝐓𝐞𝐬. It has effects on liver. Okay, the common name of 𝐓𝐞𝐬𝐭 is 𝐓𝐞𝐬, which has a very excellent effects on liver and some gastrointestinal also. Okay, GI and liver. Let us see the last question for this session. Which of the following is a known benefit of consuming garlic? Garlic reduces blood pressure and cholesterol. Yeah, reduces blood pressure is one option. Let us see another option also. Increases blood sugar levels? No. It reduces blood sugar blood pressure. And it causes hyperactivity? No. And skin elasticity? No. So, it reduces the cholesterol levels and also the blood pressure. So, the answer is A. So, that is all for this today's session, and all the best for your next coming exams. Thank you. Any questions?